To answer some of your medical questions, and joining us with all the answers is our medical specialist, Dr. David Soria. When he's not here in studio with us, he is the Chief of Emergency Medicine at Wellington Regional Medical Center. Good to see you
How are you?
week. Thanks for coming in. Doing great. Let's jump right in with our first question for you this week. This person writes, I've heard of jaundice in infants, but is it common in adults?
You know, it actually is, but it's entirely different than the jaundice that you see in kids. And jaundice, just so you know, jaundice is a yellowing of the skin and of the whites of the eye. It is not a disease in and of itself. It is a symptom of an underlying problem.
Okay.
So just so you know what can cause it, really what it is it's an accumulation of bilirubin in the blood. That can happen three ways. Either excessive breakdown of bilirubin, right? Your liver can't get rid of it, or it's a blockage from the liver to the intestines to where the bilirubin cannot be excreted. Typically, the most common cause of that is going to be something wrong with the liver, like liver failure or liver disease, right? However, there's a number of different things that can do it. Cholangitis, liver cancer, pancreatic cancer, or something called hemochromatosis, but also certain common medications can do it as well, like estrogen, all right? So it's a complex and sophisticated problem, but it is absolutely a sign of a more serious underlying one. So the bottom line is, if you are yellow, and you never were before, all right?
Something's
you got to
wrong.
get checked out.
You need
without
treatment.
a doubt.
Okay,
Yes.
Makes a lot of sense. All right, our next question for you. What are the signs of macular degeneration, and can it be treated?
Yeah, it is becoming more and more common because as we age, and since our baby boomers are getting to that age, we're seeing more and more of it. What it is when the light comes in, when you're focusing on an image, and the light comes in through your pupil, and that image is forecast on the retina, that area is called the macula. The macula over time degenerates. And there's two forms, wet and dry. The dry is the most common form, and all that is the cells around the macula break down. What happens is vessels can develop, blood vessels can grow behind the macula, and when those bleed, that's the wet form. The dry starts, wet form is the more dangerous type.
Okay.
That's what it progresses to. Who's at risk? Well, anybody who's age 75 or older is at risk. More than 30% of that patient population are developing macular degeneration now. If you smoke, if you're obese, you're at higher risk.
And quickly, I mean, can you slow it down?
You know what? There is no cure, but there are things that we can do to slow it down. Laser surgery, there's something called photodynamic therapy, and then of course most people's favorite, which is injections right into the eye.
Wow.
Yeah.
Ooh, that sounds frightening, but it's encouraging that it does work. Thank you so much for stopping by. If you have a question for Dr. Soria, you can send it to him through our website, WPTV.com. Just click on the health link there that you'll find on the right-hand side of the page. We'll see you next week, and we'll see you after the break. Stay with us.